To help us explain or understand now what type 5 is, I have with me Professor Marcel Otim, who is a professor of medicine. And Professor, you're welcome.
The mainstay of this diabetes is malnutrition. Malnutrition is important in the causation because when you are malnourished, you lack some protein radicals, which are very important, particularly methionine, which is important in detoxifying cyanide radicals. Cyanide radicals, the taustaline and the linamarin, which can damage our body tissues.
From your thesis there, which is clearly labeled 1985, is when you were reading about these things and writing about them. Why has it taken this long to actually be classified?
You could say perhaps just arrogance, because this condition is very prevalent in Africa. I did some work on this here in Uganda in 1972. If you don't have enough proteins in your diet, you do not get enough methionine, which helps to neutralize these radicals, which are mainly found in things like cassava and in poorly stored corn. Of course, there is the known aflatoxin, which can give rise to cancer of the what? Of the body, of the liver. Because aflatoxin also is another very common feature of malnutrition. But in this specific area, I think the most important thing is accumulation of cyanide radical, the taustaline and linamarin. You need methionine from the proteins to neutralize these radicals.
Yeah.
Therefore, if you don't have enough proteins in the diet from beans, meat, fish, whatever, which is commonly seen in poverty situations, destabilization, political destabilization, you end up getting damage of the pancreas and hence this kind of diabetes.
Yeah, and of course, now we know that the estimated number of people who are affected about 25 million globally, but majorly within Africa and the Asian world. And that has an impact on its treatment, therefore, I guess so.
That number alone speaks volumes. 25 million is a very big number. And it is always important for us to agree with the possibility of this being malnutritional, the reality actually, not the reality. Because managing this condition will need us to address the issue of nutrition in our populations. Very important. And hence avoiding political upheavals which can cause destabilization and hence poor nutrition.
Yeah.
Diabetes per se can cause wasting, but the wasting of malnutritional diabetes is very typical. These patients are usually young people. They tend to present with severe wasting. They tend to present with typical hair changes. The hair becomes brownish, and the skin also becomes lighter in complexion, flaky, and you may actually be able to see evidence of malnutrition on the skin.
Yeah.
And because of the fact that they may have some element of malabsorption, knowing the fact that the pancreas also manufactures enzymes for digestion, amylase, lipase, and the like. Those enzymes also can get affected, and deficiency of those enzymes will lead to malabsorption. So they will also have some element of malnutrition, wasting, and particularly edema of the legs. But one typical feature which is quite common is they're developing silky hair, silky, soft, brownish hair, plus of course wasting and features of poor development, poor growth.
Okay. And for that matter, we know that the known type 1 and type 2 sometimes tend to be lifelong. Does
Good.
this also...
Yes, that's a good question. Because of the fact that, by the way, I would like to tell the people hearing me that we have now changed our thinking about type 2. Classical type 2 diabetes now, if diagnosed early, and if the patient is given proper education, both in nutrition, exercise, and the other paraphernalia, we can reverse type 2 diabetes as we know it now. The most important thing is to diagnose it, to be aware of it, diagnose it early. And by far is the most common. About 80% of our patients in the country, in Uganda, indeed the world over, are type 2. Type 1 diabetes are not very many. These are young people. They present with very severe diabetes, with very severe passing much urine, polyuria, uh, weight loss, and we normally have a difficulty in treating them because of the fact that they almost invariably need insulin. This is an autoimmune disease where the pancreas is destroyed by our bodies producing antibodies against the beta cells which make insulin. See, one is beta cell destruction of the beta cells, whereas malnutrition is poor supply of proteins which help protect the beta cells from damage by the what? By the linamarin and the testosterone. Gaining weight is one of the problems of type 2 diabetes. And we do this, we measure these people's weights and we do what we call BMI, body mass index. Once your body mass index is above 30, we know you're obese. So obesity is a very, very important forerunner of the development of type 2. And that's why we are seeing it more and more because by the way, we rank to be the highest consumers of alcohol.
Yes.
You know that.
Yes.
So alcohol at times at some stage will add on the chance of becoming obese. That's why we're getting more and more of it. And that's why we're what 80% of the diabetics we treat are actually type 2. But they're reversible. With good education, I'm pleased to have this opportunity to tell the people of Uganda that they should not be worried about diabetes. If it's type 2, they can reverse it. Just follow what I call needs. What is needs? Nutrition, education, exercise, take your drugs, and self-monitor. Simple as that. And you don't need to do exercise running up and down all over the place. Just put on a bit of music in your own room there and dance. The other day I went to Mulago Hospital the other 2 weeks ago on a Friday, and I put on my music, and you will be surprised to find the whole diabetic patients in the clinic stood up and began dancing. The first person to stand up was an old woman, and I was really very impressed indeed. So this is the way forward. We have to educate people. What they're doing is a good job, and educate them on the issue of needs: nutrition, education, exercise, drugs, and self-monitoring. Type 1 diabetes cannot do much. These are not autoimmune disease which can complicate some of the rare infections, flus and the like. We have no say about that. Once you have got it, however, it's good for us to follow them closely, and the only best way of treating them is giving them insulin. Sometimes also they can go into honeymoon. They get diabetes for a short time, for 3 or 4 months, and then they will tend to improve. Some of them can improve permanently, but a few of them again will improve and relapse. So follow-up is always important. Message is very simple: know all the 3 types: type 1, type 2, pancreatic, or what we call diabetes.
Yeah. Okay. All right. Thank you very much, Professor Otim. And Professor Otim is a professor of medicine indeed. That's all we had for you tonight. Good evening.